Good afternoon, it's May 20th, 2022. Welcome to the latest Fireside Chat. I'm glad to be with you. We had an executive director meeting scheduled for today, but we canceled it in lieu of doing the Fireside Chat, and it's because we've seen some increase of COVID on campus. Right now we have about 18 people that we are aware of that have had COVID or have been exposed to it. All of them are in quarantine or taking other protective measures. When you put it in the context of we have 750 people living here and about 225 staff, 18 people is actually not bad, unless you're one of the 18 people, of course, and that's no fun. But we do strongly encourage residents and staff alike to wear masks and to use them in the public areas. Of course, when you're eating, you can't wear one when you're eating, of course, but we do encourage you to wear masks. It is not a requirement. But again, safety first, and be thinking about masking and social distancing, and we all know the drill. But we are pleased that things are going well and that we have as little COVID on campus as is in the greater community. The infection rate is just about 10% right now, and so we're doing very well. We've had some staff who have had COVID as well. Notably, we had several people in the food and beverage area have COVID. They're quarantining, and everybody who is on quarantine should pretty much be out by Sunday, this coming Sunday. But the COVID that we've seen in the food and beverage area is why we've had to go to buffets for just a few days. A little bit of change, but we're used to change and making pivots. I've had the question from several residents on whether or not we're going to do that fourth shot, that second booster. We've talked with our medical director, and the thought at this point in time is that most people are going to need to get a booster this fall around flu time. And so we're holding off unless we see a significant increase in COVID over and above what we have seen. However, if you are more comfortable getting that fourth booster, you can certainly get one at any one of the local drugstores, CVS, Walgreens, and so on. So if you are uncomfortable not having that second booster, please go ahead and make those arrangements. Staffing. I have a glimmer of hope for you. We have been improving staffing, and that's actually why we're able to provide visitor service at lunchtime from 10 to 2, Monday through Friday in the independent dining areas. We're excited about that, and we still are working on staff. Like I say, it's a glimmer of hope. So we have been seeing a smattering of people come in, and we're very pleased about that. The second part of that is staffing in the healthcare center. We're still challenged by not having enough nursing assistants, and so we have a lot of people working a lot of hours. And so next time you see one of our staff members, just be sure to say thanks to them for that. But the good news with the staffing is we have been able to hire several nurses. And what that means for us is that we're going to be able to expand starting in the next two weeks. We're going to be expanding the number of people that we can serve. We're not opening the rehab area yet until we get a little bit more staffing. And we also have to have time for the new nursing staff to get trained and oriented and those kinds of things. And we want to make sure that we're providing the highest quality care that we can. So that's very good news. We have a hope that rehab will at least be partially open, but stay tuned for that. That's going to be a while yet. But for the time being, we're going to be able to open up a few more beds. And the reason we held the number of beds is there are staffing ratios that are required by the state. And so with the additional nursing staff, we're able to meet those requirements and able to open up for a few more beds. Finally, good news. Many of you know that we've had a number of vacancies in the apartments. Let me explain the vacancies. For about 18 months during COVID, we were unable to bring people into and to view and walk through the apartments. And nobody wants to buy an apartment or pay for an apartment that they've never seen. And so we basically brought very few, if anybody, in during COVID. At the same time, we had the normal attrition with people moving to higher levels of care and some people passing away and so on. And so we have about 2 years of attrition that we're having to catch up to. And so we had a number of vacant apartments, as I've mentioned before in earlier meetings. The good news is marketing has had a great deal of success since April 1st. And we have somewhere between 14 and 17 of those vacant apartments that are now committed. And we have some more coming in the near future. So we're very, very pleased. Someone asked me if the cupcake crawl that we had a month or so ago was successful. It was very successful. We had over 180 people attend, and so far we've had six people actually decide to move into the apartments since then through that event. We had a tea this last weekend. It wasn't quite as successful, and it's too early yet to tell the results of that. So, the main points: COVID, it's under control. We're continuing to evaluate and we're watching it. If you want a booster, you can get one, but you'll need to go to a local drugstore. We're having some success with staffing. It's not as much as we want yet, but we have not given up. We have had over 125 interviews scheduled in the last few weeks, and we are continuing to work very, very hard at finding additional staff, and we are having some success. I call it a glimmer of hope. And finally, with the apartment sales, things are going very well, and I know residents are really supporting and speaking well of Rolling Green Village. And as you know, that personal reference and that personal positive note for Rolling Green makes a big difference. That's all I have for today, and thank you for your time.